Trauma affects thousands of people in so many different ways, and because of this, trauma treatment is a new experience with every patient. Dr. Michael Grodin has helped a diverse group of over 3,000 survivors of torture overcome trauma using integrative therapy approach combining Eastern and Western medicine. In this clip, Dr. Ruth Buczynski interviews Dr. Michael Grodin about some of his first experiences working with Buddhist monks.
I'm Dr. Ruth Buczynski, a licensed psychologist in Connecticut and the president of the National Institute for the Clinical Application of Behavioral Medicine. Our guest is Dr. Michael Grodin. He is a psychiatrist who works with trauma survivors. He's the co-director of the Boston Center for Refugee Health and Human Rights, as well as a professor of psychiatry. The way I first heard of your work was with the Tibetan monks, and I was wondering if you could start by telling us about your work there.
Well, I've been interested in my entire career, actually, with the question of resiliency, about why some people do better than others when they deal with trauma. And so I've been working with survivors of many problems, many genocides, and many serious political and social upheavals. A number of years ago, I founded a center to care for survivors of torture and refugee trauma, and have been working with Holocaust survivors for many, many years. But I became involved with some Tibetans who have suffered horribly in China, in Tibet, Tibetan monks who were saying free Tibet and were arrested and put in prison for 3, 4, 5, 7, 8 years and tortured every day, electrocuted and mentally and physically tortured. And many of them were able to either escape or ultimately were released, went through the Himalayas, and eventually ended up in Dharamsala, India, which is where the Dalai Lama's government is in exile, and then came to the U.S. in various ways to teach or to join a community. And we have a Tibetan community here in Boston, which I became involved with. And I started to treat one Tibetan monk, and then another Tibetan monk would show up. And pretty soon I had a practice of 10 to 12 Tibetan monks who had all been imprisoned and tortured in China, in Tibet. And they came in with various problems. And so I began trying to study and learn about the treatment of these monks.
So was your treatment what we would consider a traditional, like they would come in and you would...
Well, first of all, they would show up at the clinic in their robes, which is a little unique. And the first thing that they would do is they'd come and hold my hand. Now, one of the things I also teach the psychiatry residents is boundaries and boundary issues. And so it was kind of interesting that the monks would come and grab my hand and hold it as we walked down the hall. But that was, of course, culturally acceptable and culturally appropriate. Anyway, they would come in my office with their robes and sit, and we would start off by saying, oftentimes, some chanting. And then I would say, why don't you teach me about Buddhism? Because obviously psychotherapy was not within the context of what that was what I was doing to a degree, but that was not culturally very acceptable to their general understanding of how and why they were coming to see me. They were coming to see me really as someone who was sensitive and involved in the Tibetan community and had helped other monks. So they came in, and what we would do is they would teach me about Buddhism, and in the context of that, their various symptoms and problems would come up.
Now, did you do any group therapy with them?
That's a good question. We use groups quite a bit in the center, but I didn't do groups with the Tibetans. And I tell you why. Although I think groups are very, very important, and in general, when we work with torture survivors, the sooner we can get them into a group setting, better. It regularizes their past experience and allows them to share and not see themselves as unique or special or the only person that has these problems, but they can see that other people have suffered and can get better. But there's also always a problem of confidentiality, and oftentimes when you get people from the same country or the same area together in a group, there's a concern about maintaining their privacy.
Did you find that when they would remember their traumas, they were more, it was as if they were reliving the trauma?
Yeah, again, that's true of all the torture survivors I deal with, is that they have flashbacks where they actually are there, back in the torture chamber. And so one of the things that we try to do is to get them to remember without reliving. And so, you can't get rid of the memory. And if you try, you'll numb yourself. You can't filter some memories and not other memories. The idea is to have the memory that be the past in the past, and to not have it constantly be coming up in the present. And so you're re-experiencing it. So it's a memory that you have as opposed to a constant in the present reliving of the experience. And that takes some processing. But over time, patients are able to come back and live their lives in the present.
There's a lot more to learn about the treatment of trauma survivors. For more information, visit our blog at www.nicabm.com/nicabmblog or attend a free teleseminar at www.nicabm.com/teleseminar/2009. This December, NICABM will host its 21st International Psychology of Health, Immunity, and Disease Conference on the beautiful Hilton Head Island in South Carolina. Hundreds of practitioners will be coming from all over the United States and many parts of the world. Among the nearly 50 speakers, Dr. Grodin will be giving a class on Beyond Talk, Caring for Survivors of Torture. There will be several other sessions on related topics, including The Heart Living Fearlessly, The Wisdom of Attunement, EMDR, a trauma therapy power tool, and Imagine This, Our Military is Reshaping Mental Health Care. To see more information about the December conference and to sign up to attend and receive CE credits, please visit www.nicabm.com/DECCON09.